Today we're going to talk a little bit about how much lifestyle changes play a role in coronary artery calcium or plaquing around the heart. So if you're interested in finding out more, then this video is definitely for you. Hello, I'm Dr. James Bogash, publisher of Modern Health Myths, and today we're going to talk about how much the accepted 7 factors for heart-healthy behaviors based on the American Heart Association and how much they related to what's CAC, coronary artery calcium. So we can actually do ultra-fast CT scans to look at the heart and determine how much plaquing is around the heart. Generally, those scores go from 0 to 400. Anything over 100 is considered having heart disease. So obviously, the higher that number goes up, the more needed life insurance should be. The closer we get to 400, the scarier those are, and the higher likelihood that somebody has imminent heart disease risk coming up. These 7 factors that are identified, and even these 7 factors are a cakewalk. They're not that difficult to attain. Non-smoking, making sure that your BMI is less than 25. Active, there's some specific guidelines, but even those specific guidelines are not what I would recommend. I'd recommend something more stringent. But regardless, they're easy guidelines to follow. Healthy diet index, maintaining a certain level of healthy diet. Again, these parameters are very easy and nothing specific that I would typically recommend. Cholesterol under 200, non-medicated. So if you're medicated under 200, that doesn't count. Blood pressure under 120/80, again, unmedicated. Medicated is not going to count as a healthy behavior. And fasting blood sugar under 100, again, unmedicated. So how much did if we have these 7 factors, then how much did they play a role in having coronary artery calcium? First of all, in this study of almost right around 1,700 people, they found that average age was 56.8, so just a little bit older than I am now, so almost 57. The number of people who had, the average number of healthy lifestyle factors were 3. This is 3 out of 7. Again, these 7 aren't that hard to maintain. The number of people out of 1,700 that had all 7 of these heart-healthy habits, 0. We couldn't describe more of a problem than the fact that we can't, as a population, 1,700 people can't adopt 7 relatively easy to obtain or easy to adhere to lifestyle habits. But when they found that people had followed at least 2 behaviors, they had a 63% lower likelihood of having a CAC score of 100. So basically 63% lower risk of having heart disease as based on CT scans. You up that to 3 factors, that jumps up to 65%. 4 factors, 73% lower risk of having a CAC of 100 or higher. It's with 4 factors. That's not even all 7. These 7 are generally not that hard to follow. This is one of the reasons why I continue to say that heart disease is almost entirely lifestyle driven. If you don't want to have a heart attack or heart disease, I don't care about family history. It is almost entirely driven by the choices that you make, and we continue to see that in study after study after study supporting the idea that lifestyle plays a massive role in your risk of heart disease. As always, I'll post a link to this particular study in the comment section. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.